Hi, this is Dr. Bhushan Zade, Director, Radiation Oncology and CyberKnife Radiosurgery, Ruby Hall Clinic, Pune. Today we'll talk about radiation therapy, quality of life and cancer survivors. Like we use radiation therapy in early stages of cancer. We cure patients, and when they are kind of a long-term survivors, what kind of a quality of life impact they get in their future life because of radiation we used in their treatment journey. Let us talk about three most common cancers what we treat routinely. First, head and neck cancer, breast cancer and pelvic malignancy, which is like a cervical cancer, which is very common in Indian females or say rural females. Now, these are three cancers where role of radiation is highly established with a curative intent. So almost all cases of breast cancer will receive radiation. Almost all cases of, except very early, will receive radiation therapy, and all cervical malignancy, they 80-90% end up getting radiation. So radiation therapy will in general have 2-3 common side effects irrespective of site. It will dry up the mucosa. Like oral cavity is a moist structure. It has got major salivary glands and got many minor salivary glands. Now, depending upon the volume of radiation, what we are treating, like either we are treating tongue cancer, we are treating buccal mucosa cancer, we are treating some laryngeal malignancy, there will be some volume of defined volume of radiation. Now, in that volume of radiation, whatever these minor salivary gland or whatever amount of mucosa would come, it will get side effect with respect to time and with respect to dose. It will go on increasing with time, it will reduce, but it will leave some kind of an impact in a long-term kind of a survival. So, typically it will dry that mucosa because of damage to the minor salivary gland. Now, we can always reduce this by taking due care during the radiation and after the radiation. We can reduce the indirect damage happening to this volume by reducing doses going to the surrounding normal structures. For example, parotid glands are situated on the sides of face and the patient is getting treated for the oral cavity. Now, radiation to oral cavity will always give some radiation to the parotid gland, but if with the use of conformal radiation like image guided radiation or rapid arc with image guidance, we could reduce the dose of radiation going to the parotid glands. We can reduce the long-term impact of drying the oral cavity by preserving parotid glands. So these kind of reducing collateral damage by using high precision radiation will be useful in the long-term survivors getting less side effects of radiation. So take an example of breast cancer. Like when we treat breast, what structure are important to be preserved? Below the chest wall we have lungs, left side we have heart. So while giving radiation to breast, we have to be very sure that the lungs and heart getting less and less dose. So there are special techniques to use, like we use deep inspirative breath hold technique while giving radiation to breast so that the chest wall goes little away from the cardiac structure. There is a gap created because of the deep inflation. That gap we use to push heart away from the chest wall or say chest wall away from the heart and giving radiation in that particular position so that heart gets minimum dose of radiation. These kind of techniques will be very useful preserving the cardiac or lung function in the long-term survivors. Then we talk about pelvic radiation. Typically, pelvic organs like bladder, rectum and intestine will get some impact of radiation. In bladder, patient may be into that increased frequency of urination. Sometimes they go very frequently to urine. Sometimes the motion frequency goes up because of radiation. The bowel becomes sensitive. So sometimes you eat some spicy food, you get kind of intolerance situation. They go for motion many times, or there is a colic abdominal pain, abdominal discomfort. There are so many things which can happen. So basically the organs become sensitive because of radiation. Now again, what we can do to reduce long-term side effects of radiation? Again, common things first. Conformal radiation. Time and again we keep on stressing more conformal radiation, lesser doses to the normal structures, so lesser side effect, better recovery. So And at the same time, you can always have a diet modification. Like in a pelvic radiation, use little less spicy diet, more of water intake, a high fibrous diet, add ghee into your food, buttermilk is very good. These are simple modification which we can do with our lifestyle and diet. Walking is a fantastic exercise for pelvic radiotherapy because it will keep bowel moving, healthy, and walking is anyway generally good. So these measures will certainly be useful as far as long-term quality of life is concerned in a radiated patient. Of course, again, this is a very general discussion. For some particular situation, we can always discuss in detail looking at the case report and the patient. You can always visit us to a clinic, write us on an email, or reach us on our contact number. We will be happy to help you. Thank you so much.